Hi, I am Dr. Santosh Mahanor, MD Homeopath. Want to share with you my views about COVID-19 and homeopathy because throughout the world this COVID-19 is spread as very fastly, and so death from this COVID-19 are again too much in the countries like Italy, Spain and Iran. So for that, most of the world is become panicked because of due to the COVID-19. So I am homeopath. So I want to share with you my views and what homeopathy thinks about this COVID-19. What is the approach of homeopathy in this epidemic or pandemic diseases? What I learned from Master Hahnemann or his teachings, he mentions in his book Organ of Medicine, 6th edition, in aphorism number 73, it is nothing but the transient explosion of latent psora. Means it is an acute miasm. So we need to treat this accordingly. So how to manage that COVID-19 or this epidemic or any pandemic conditions? Masters gives the guidelines in aphorism number 100 to 102. So it is very similar like a totality of a picture or totality of a disease. But here he mentions that you have to collect or gather the data from not only from the 1 or 2 patients or 3 patients. You need to be much more, community has to be studied and gather the data and the symptom totality or the portrait of that epidemic, and accordingly treat with that. If you get a success in treating the so many cases with this specific remedy or specific drug, so this drug might be a genus epidemicus. So from these guidelines, nowadays this COVID-19 is spreading all over the world. So as we know that it is mostly spreading very fastly in the cold atmospheric countries, so where the temperature is very less, less than 15 degrees centigrade. But equally it spreads in other countries, other atmospheric pressures, but its spread is, we are looking very slow, or it is might be because of due to the government's some precautions or preventive measures. But as we know that the pathological process or pathological progress of this COVID-19, everybody knows about that it is in a virus, so how it spreads and how it is get contacted and everything. But after that, what happens with the body or with the patients, I want to discuss with you. That is when we get infected with this COVID-19, this coronavirus. So this remains for variable approximately 14 days of its incubation period, and then enters into our mucous membranes or in the bloodstream. It starts to produce the very common symptoms like flu, the fever, running nose, cough, crawling, teasing cough, irritating cough, sore throat, and all these things. But most of the patients are recover at that stage only. Those have very good immunity, so they recover spontaneously, so they not need any kind of treatment for the termination of this epidemic. But few of patients, though mostly the elderly ones above 60 who had some other pathologies or very immunocompromised patients, itself it is an immunocompromised disease or pneumonia like conditions. So when this infection traverses from upper respiratory tract to the lower respiratory tract, it enters windpipe. So after entering into the windpipe, so these viruses may trickle there and produces some irritating and insistent cough. So in response to that virus, our immune system or defense mechanisms in activation and start to produce some inflammatory conditions, mostly the catarrhal inflammation. So there is a high grade fever, mild to high grade fever. So there is inflammation of tonsils also. So there is a production of cough into the windpipe will start there, and because of that, so along with that these viruses is replicating very fastly. That will be the threatening point for the patients. As body is producing too much cough to inactivate or to non-function this virus, but the replication and production of virus bodies is too much high, so body is not able to accustom that unable to make inactivate this virus, and this viruses by process of replication, they use the water content into that fluids and so as days passes, so this cup becomes very dry and very thick and sticky cup, so very tough cup. So that cup filled with the lungs, and the lungs and alveoli and every villi will be get filled with that cup. So patient is unable to take a breathing, or he is difficulty in respiration, so dyspnea and all these things will develop there. And because of lack of oxygen, he is not able to inspire or expire. So there is a imbalances into the oxygen and carbon dioxide exchange, that is a gases exchange mechanism will get disturbed. And because of that, so there is a continuous deficiency of oxygen leads to the electrolyte imbalances, ARF, and patients will landed into the very emergency situation, multi-organ failure, and death will soon occur. So that type of picture will be seen. So from that we see the portrait of that COVID-19 when it produces the common symptoms like influenza symptoms to the symptoms of secretions, and the secretions are unable to expel, unable to expectorate, and they are sticking there, or the suppression of discharges are there. So for that, in homeopathy, we find out the very correct similimum in that situation is the camphor is there. So there are three remedies what I understand from the master's teaching. So what I refer in the Materia Medica Pura and chronic diseases, theory of chronic disease, he mentions the symptoms what actually we seen in the COVID-19. So I mentioned in the descriptions what are the symptoms of this COVID-19 and what are the symptoms of the arsenic album and camphor. But as we prefer, so camphor is very much suitable to competing with the as compared to the arsenic. But these drugs are equally, we can use one arsenic and camphor. So whenever we got a results from results from any either camphor or any arsenic, so then you can select the genus epidemicus as a arsenic or a camphor. So but what I want to express my views about COVID-19 is that, so masters said that you need to treat the cases with these specific remedies. So whether any remedy will give the result, that will be the her future genus epidemics, and this remedy will be used as a preventive to control that COVID-19. So another some drugs are also we can use in that situations, that is anti-immunity is also there, and some in rare cases we need to treat with the anti-Rs also. But most frequently, so the camphor will comes in front of you, very similarity of the symptoms will be there, and next one was an arsenic album. So equally we can use and you can try these remedies. Then my humble request to the WHO and some the health ministries and the homeopathic fraternity, so until you don't have any specific remedy or vaccine to this COVID-19, you people will try to use that homeopathic treatment for the management and the prevention of COVID-19. So that is my whole approach and what my thoughts about the COVID-19 and homeopathy. Thank you.